Good afternoon, everyone. So, I think last time
Mm,
we had some few discussions concerning the overview of this course. So today we'll start with what with the name. Um, who is that? I keep on muting all of you, but someone allow participants to mute. No. Okay. So as I earlier told you, that was last week. This course would center on um psychology. So we'll delve into the introductory aspects of psychology and some tidbit of it in that regard. So today's discussion was centered on the introduction of psychology. So with regards to psychology in itself, most people have certain misconceptions surrounding it. And to move on, I just want to let you know that when it comes to this class, I normally mute everyone so that you wouldn't get opportunity to unmute yourself. So usually what happens is that intermittently, I would give up on the opportunity for you to ask questions or clarification. So it means as time goes on, if you have questions or clarification concerning certain things I'm discussing, what you can do is that you can use to the emoji that makes you raise up your hand. You can use that emoji to raise up your hand so that intermittently, when I say, okay, any questions or clarification, I would go through the chat section or the participant section. Those who use the emoji to raise up their hand, according to first come, first serve. I'll give each person opportunity to ask his or her questions or clarifications. So that's how normally I move when it comes to this. So kindly bear with me in that manner. All right. So back to what I was saying. I'm saying when it comes to psychology in itself, um, most people have some misconceptions surrounding psychology. So please, if you can't hear, then it means that it has to do with your network. Um, because I have turned on my volume 100%. So maybe try and check your gadget that you are using. All right. So most people think psychology, anyone who is a psychologist, we read people's mind. So the moment someone asks you, "Oh, what profession do you find yourself in?" and you tell the person, "Oh, I'm a psychologist," the person will say, "Hey, then I need to be careful because I don't want you to know what I'm really thinking." Some people think that when it comes to psychologists, we can just know what someone is thinking and just profess and say, "Okay, this is what you are really thinking," which that's not so. No being could know what you are really thinking. The only person who can do that is what is God. Nobody can know. Okay, as we are here, there's no way I would know. Okay, what Amma or Kwame is really thinking about. Again, another misconception people have is that when it comes to psychologists too, um, it's all about magics and tricks. So those magical shows being displayed, some people think, okay, it has some psychological connotations to it and everything, which in reality it has no correlation with what with psychology. Also, some people think that okay, when someone is able to prophesy or um, tell you about your future, what will happen to you, that's a saying and what have you. Some people think that that also has some relationship with psychology, which is in a sharp contrast in that regard. So it means that when it comes to psychologists, our main ulterior motive is to understand what is really causing the behavior, how is the behavior really manifesting in a person's life, and why is that sort of behavior really what happening? So it means psychologists are key motive is to understand human and lower organisms, their behavior. That's the main or motive, understanding people's organisms' what behavior. So in the course of us trying to delve deeper to understand these things, we pose these questions to seek answers. Why is that person really behaving the way he or she is behaving? How does that person really behaves? And what really pushes that person to behave in that manner? So these are the main key answers we tend to what to key questions we tend to what answer in that manner. So we have several definitions when it comes to what makes um upper psychology. So what really becomes similar when it comes to the various definitions has to do with the bolding key terms I have done within the slide. We see that our bolding some key terms that cut across the various what definitions you come across when it comes to psychology. So this within your slide, the definition I projected was propounded by someone known as Kuhn in 2004. And he defines psychology as the scientific study of human behavior and other lower organisms. So the lower organisms here are animals. So it means that per this definition, psychology is a scientific study. And also the ulterior motive is to what? Is to understand behavior. So that's the main motive surrounding what psychology. So psychology was really born out of two Greek words that made up what psychology is. That's psyche and logos, which I've already defined these things in the slide. Psyche means mind, logos means knowledge. So as I said, with psychology, our focus will be on the ones that have both in the scientific study and behavior. So it means psychology is a science, and like any science, it follows some systematic procedure. And you know, when we say something follows systematic procedure, it means that it follows some steps. For us to understand people's behavior, you don't just um, do it in haphazardly. There are certain steps you are supposed to follow to arrive at a conclusion and say, oh, this is how this person's behavior is like. So in psychological realms, that is how the way manner in which you are supposed to understand behavior and come to conclusion. You are supposed to follow certain steps. So that's the step we'll be delving into. So it means like any scientific study, it has certain steps. And the first systematic procedure that makes up any scientific study has to do with something known as it has to do with something known as empirical evidence. Empirical evidence. So please hold on for me for some few minutes. Since oh yes, sorry about that. So as I said, the first characteristic or feature when it comes to any scientific study has to do with empirical evidence, or some people say empirical backing. It means the same thing. So let me throw this question to the class. Or before that, let me give a scenario. You know, whenever we talk about evidence, it means that we want you to have proof that something really happened. So a preamble that I was set to ask my question is, I don't know how many of you that heard this happened in Kumasi, whereby it was trending in the news. I think TV3 even captured it and other local stations pick it up. I think a year ago concerning a woman who happened to be with her house boy and the house guy, the house help to a large extent murdered it was alleged that the house help came to the house for barely a month and murdered the woman cold-blooded. And it was also alleged that okay, he got help. That's the house help got help from one of his colleagues to murder the woman. So the case is still in court, and they are yet to convict the house help and also the person who assisted in the murder. And it's also so federal intelligence was also gotten that he took the woman some vehicle and some other properties, sold the car, that's a vehicle, and also and other stuff. Yeah. So I believe some of you got this news. So let's say you are a police officer, that's a CID per se, and you've been assigned to this case to really provide detailed evidence as to whether this house help, as I said, it was alleged, this house help really committed the murder. So you were suddenly called by say neighbors that oh this woman blah 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 has been murdered in cold blood. So you just came to the crime scene and you've been told to investigate this case to gather information who really killed the person. Let's assume that we don't know that the household was the one who killed. Investigate out who really killed this person. How was this done? So pin the person who really killed. So how would you gather your evidence or information? How? So that's my question pertaining to this scenario. So please, if you want to answer, you can use the emoji to raise up your hand. Then I would mention your name or mute and give you access to unmute your mic in that regard. Okay. So Bridget, please go ahead. Bridget, you can unmute your mic. I have given you access to unmute it.
Per the scenario you gave, she was murdered. So I would look for the murder weapon and screen for fingerprints. I don't know if Ghana police, they have the access there, but that was what I would do.
Okay. Okay. Good. Good. Okay. So Bridget has given us other means in which she would gather her evidence. So I think another person's hand is up. Let's sorry. So Mercy, I think you came first. So Mercy, you can unmute your mic. Mercy, please go ahead. Hello, Mercy. All right. So I think Mercy is having some challenges. So let me give access to Georgina. Georgina, you can go ahead.
Okay, so sir, please, based on the scenario you just gave, there are some items that are also missing that are supposed to be stolen the guy who did there. So I also look out for those items, whether they are in possession of the accused person.
Okay, so you trace the items that was stolen by the accused. So let's assume that currently we don't know the accused. So you are trying to find evidences to see who they are, who really killed the murder. Who really killed the woman in that manner. So it means you trace the items that will let you know that okay, this person could have a hand in what's in the case. All right. So let me give one last person chance. I think the next person in is Aziz. So please, Aziz, go ahead.
Yes. Please, I also think that definitely there will be people around the scene.
Yeah.
So you can also make inquiries by asking students questions from those people, and you'll be able to derive your points from there.
Exactly. Yeah. So you are all what right pertaining to this. You are all right in that manner. So you could see that um the way and manner in which the police officers they are gathering their information is really, really tied towards the empirical evidence you are referring to. Why? Because for them to gather their evidence, these are the key things they do. They will do some forensic tests. So I think the first person who answered this question emphasized that okay, she would first run fingerprints to see the person who really used a knife on the woman. If the murder really used his or her bare hands to commit the act, fine. Then the fingerprint would be on the knife. So that's the testing the officers are also doing. Apart from that, some of you also said, "Oh, we would do what? I would do one-on-one interview. I would what? I would interview as a CID. I would interview the neighbors around just to find out as to whether they have any fair idea about what's really happened." And that is the interviews we are referring to. Interviews simply means you are having one-on-one discussions with the people of interest about the behavior you are understudying. Then another last thing that we normally do is observation. Observation has to do with you sensing the behavior using any of your five sense organs. So whether you the officer, maybe you were in there when the incident happened. So whether you heard something or you saw something, or sometimes even CCTV cameras around your neighbors could give you a fair idea about what really transpired. That's typical of what observation. So these are the three main mechanisms as to how we can understudy people's behavior. Let me to gather evidence. Sorry, let me throw your mind again back to during the time that you were not feeling well. Or I believe all of you are nurses. Yeah, all of you are nurses. So in clinical settings, especially when a patient walks in, OPD basis, and let's say go to come to you or even go to a medical officer. The moment the person comes and it's about to sit down, you sometimes even observe the patient. And you observing the patient gives you certain clues as to what really brought the person. So let's say the person just came in with what? With malaria. So as the person is about to sit, you could see that someone who is suffering from malaria, mostly they would shiver. they would also have what? Their temperature would also be what? Would also be high in that manner. So you observing the person was shivering. It's typical of what? Of observation. So the moment you observe this thing happening, it gives you a certain impression in your mind that this thing there, I suspect it might be this condition, but I don't want to be in haste to conclude. So what would you do? You will ask the person, the patient, and also the relative. Oh, mommy, what really brought you here today? Then what happens? The patient would elicit or tell you over some days now how she has been feeling and what have you. So you having conversations with the patient concerning her behavior is the interview that we are talking about. Apart from that, you can also you sometimes even ask the relative questions. So interviews is not only tied towards the patient, but also what relative and even the person who brought the patient of interest. Then after you've observed, you've done your interview, the last thing you do is that you don't want to make mistakes. So what would you do? After you've gathered your information by through observation and interview, the last thing that you normally do is to what? Is to tell the patient to go and run some lab test. After the lab test comes in and truly the lab confirms that okay, the person has malaria, then what would you do? You then run some interventions by providing some medications to the patient. So that's how empirical evidence is normally done. One last thing is also in our clinical setting, that's the psychiatry department, we follow the same step. So for instance, when someone is depressed, you know the various signs of depression. So the moment I'm in the consulting room, a patient just come, then all of a sudden the patient um finds it hard to maintain eye contact. You could see that she has this gloomy face. When I say gloomy face, in key, we call it onenima mobo. And also, some people would have this crying spells. And even when you are trying to initiate conversations with them, they don't have the energy to even talk to you. All these things gives us signals that this woman or this man, I think he might be experiencing depression. But you don't want to be in haste to conclude because you might be wrong when you solely rely on observation. So what do? We further what to do interview, ask the person, what really brought you here today? I've realized that okay, as you came in, you've been having crying spells, or you hardly maintain eye contact, or your face is always on the floor. Why? What is happening? Then the person will open up, tell you certain things. Sometimes in our psychiatry department, sometimes some of the patients they come in with poor insight. So what do? We sometimes get information from relatives and friends and other companions who brought the patient. Then the last thing we do is to run tests. So in psychology, for instance, we run something known as psychological test. We run something known as psychological test on most of our patients. So after we've observed, done the interview, the last thing that we do to confirm is to run psychological test, which we'll discuss that later, what the psychological test entails. So you during your spare time, you can just even Google, when it comes to depression, for instance, we run a test known as Beck Depression Inventory. The Beck is BECK, Beck Depression Inventory. All right. So another feature of any scientific study is replicability. Replicability comes from the word known as to replicate, and which simply means to repeat, which simply means to repeat. So what replicability stands for is that you are supposed to, you, the person doing the thing, the clinician or the person observing the behavior, after you've done your investigations, or even in the course of you doing your investigation, it is really imperative that you are supposed to um, make sure that you document all the procedures you used to do your investigation so that anyone could what could pick your investigative work, um, do similar thing. It could be that the person can do similar thing on what on the same patient or similar people suffering the same condition, and arrive at what at similar findings or results that you came out with. So that's why when you come to uh, clinical setting, hospitals, clinics, and other health facilities, normally when the patient comes in, we tell the patient, um, you buy a folder, or I think currently most hospitals and clinics are using digitization system. So normally what we do is that we'll write everything within the patient folder, within the PC, so that another person or another clinician could just come in, go through what we've done, and if the person wants to repeat the same thing on any other person, would be able to do it. I'm talking about the method we use to arrive at a conclusion. They can repeat the same thing. So that's the essence of documentation. So replicability is much more related to documentation, repeating the procedures used in the investigations. That's the empirical evidence. So that another person could repeat the same thing and come to similar conclusions. That's the main rationale behind this. Um, Abiba, you're saying that there's bad network you can't hear. Please, sorry about that. I believe it might be your network. So kindly maybe shift yourself a bit or move to another place. Okay. Then the next one is quantifiability. Quantifiability. So quantifiability comes from the word to quantify or quantity. So it means with quantifiability, we are dealing with numbers. We are dealing with numbers. So for instance, when I ask you what is your weight or what is your height, it's something that you can tell me by easily measuring. Because when it comes to weight, we use what? We use a weighing scale to measure our weight. Then with um our height, we can just use a rule just to measure our height. But when I ask you to quantify most of these psychological constructs, like um Kerele, as you are here, what's the number of depression or anxiety in you? When I ask you this question, it will sound really weird and awkward. You might say, how? But no matter what, we all have, even if we are behaving normal and what have you, we all have some level of anxiety and all the psychological construct in us. Just that is in a normalcy level because of the chemicals that regulate us, our mood and everything. It's scarily normal. But we all have it. So one might ask, So how would we be able to measure someone's anxiety, depression, and what have you? So that's when psychologists came in just to find certain instruments that can be used to measure. So you remember I told you to you can use your gadget to do your own search on in trying to find Beck depression inventory. So let me try and project my browser. So Beck, yeah. Okay, so this is how, let me, so this is how Beck depression inventory looks like. We have several instruments which is normally used to measure depression. Beck depression inventory is one of the instruments clinicians normally use. So the about 21 items, you know. So the first item, the first question, let me annotate. Okay, I'm trying to annotate, yeah. So that's question one. We'll first explore whether the patient is sad. So it means one, these are the keys or numbers. So the patient is supposed to zero, this statement is assigned to zero under question one. Then when it comes to three, this statement is assigned to three. So it means for each question, the patient is supposed to circle one of the options, option 0 to 3. The patient is supposed to select one of it. So if the patient, for instance, circle 0 for option 1, that's item 1. It's indicate that the patient is trying to communicate that he or she does not feel what sad. But in situations whereby the patient circles 3, then it means this statement applies to the patient. I'm so sad and unhappy that I cannot stand it. So let's say this is how the patient A felt. I'll just do 1 up to 5. These are the options patient A did. So the patient would fill everything from question 1 up to 21. So let's assume that these are the responses the patient did. So for us to quantify, we need to add these numbers the patient circled. So 3 plus 2, which is 5, plus 2, 7, plus 1, 8, plus 3, 11. So let's assume that at the end of the day, after the patient went through these 21 items, the clinician will score, and the clinician score to get a score of 11. So it means that per this instrument used, the patient has a depression score of 11. So that's how we measure what individual's depression. Then afterwards, after you've gotten the score, this is the interpretation. So let's assume that, as I said, the patient had 11. So this is this interpretation in relation to the scores. So let me, delete this. So we know that, okay, the person had a score of 11. So we could see that per the scoring, they are saying when someone gets a score of 1 to 10, this is what the interpretation is all about. These ups and downs are considered normal. So they are saying that when a patient gets a score of 11, that means the patient what condition is normal. Then when the person gets a score of 11 to 16, it means that the person has what? Mild depression. So you remember I told you, let's assume this patient had 11 when we sum them up. So it means per the 11, when you check the interpretation, it means the patient has what? Mild depression. Whereas someone gets 41 and above, then it means that the person will have what? Extreme form of what? Of depression. So that's how clinicians has been able to what quantify depression in that regard using psychological tests. So this is one type of psychological test which is normally used. All right, let me raise it. Then the last one. The last one has to do with after you've done these three things, the last thing is to always, the ultimate goal is what? Is to generalize your findings. Generalize your finding, which is generalizability. So what it simply means is that the information that you've gotten, you are supposed to what? Extend it to a wider population. So for instance, let's say as a researcher, and I think next semester, for instance, I think this semester you'll be doing research, which you'd, as you get to level 400 first semester, it is mandatory for you to do a research work. So you realize that in the course of you doing the research, you select some few individuals to represent your population. So let's say your population is Garden City University students. You want to do a research among Garden City University students. And let's say the topic you want to do is on anxiety. So you've realized that, oh, when it is getting to a week or some few days for students to write exams, they are always anxious. So you want to conduct a research on this to find out why students become anxious, and how do they normally what? Experience these anxiety. So you did your research, use some of the instruments, or ask your questions on about 50 students within Garden City University. You did your research only on 50 students. And at the end of the day, for your results, you got a result that, oh, majority of these Garden City University students, that's the 50 students, they gave you information that, oh, they are anxious. For the 50 students that you interviewed or ran tests on them, a finding came that, oh, majority of them are anxious. So at the end of the day, what do? You normally what? Generalize it and say, oh, Garden City University students are anxious. Although you did a study on on only 50 students, but you normally extend your findings to the wider set of of your population, which is Garden City, and normally say, oh, City University students are anxious. You don't just say, oh, the 50 students in Garden City are anxious. We normally generalize such findings. So that's how generalizability works. Another example is during the time that COVID was prevalent, you realize WHO came out with with various symptoms of how virus work within humans. But let me ask you, did any scientist or anyone came to you per se to run a test on you for us to confirm that, oh, this is how the virus really works? within you. So these are the various symptoms of the virus. Nope. You realize the WHO conducted the study on few individuals. Then at the end of the day, they understudied them and generalized the entire finding and said, oh, the few individuals that we've studied them, we've realized that this is how the virus works within them. So it means that the entire human race, this is how the virus really works. So they generalized their findings and then extended to a wider population and said, when it comes to the virus, this is how it works among all of us. So that is how um, generalizability is all about. So in terms of characteristics of scientific study, these are the four main criteria we normally look out for. So please, any question with respect to characteristic of science or what makes psychology a science? Any question or clarification concerning what we just discussed? All right, so I think the first hand is Bridget. So Bridget, please go ahead.
Sir, please, I want to know if all sciences must have these characteristics, or the four. Must every science have the four, or they can have just two, three, or something?
Yeah, with any scientific realms, it should follow these four steps. It's really imperative. And that is what normally we intend to achieve in that manner. All right. So Esther Techi, please unmute your mic. Esther, you haven't unmuted your mic. So please, I've given you access to unmute it. Okay, so I'm assuming that Esther mistakenly raised up her hand. Let me move on to the next person. Vivian, please go ahead.
Okay, thank you, sir. Please, I'm a bit confused. You said the steps are three, but as I was following, I was able to capture only three. I'm hoping you can help me with the fourth one. You talked about the quantifiability and then the generalizability and then the replicability. Sorry. I didn't get the fourth one. Can you please help me with it?
That's the first one that
Thank
we
you.
did. Empirical evidence. That was
Okay.
what I used. Scenarios
Okay.
in that manner. All right.
Okay. I got it. Thank you, sir.
All right. Okay. So I think the next person is Mavis. So Mavis, please unmute your mic.
Okay, so I understand the generalizability. You were giving the COVID as an example.
Okay.
They generalized it to the whole population, but then the quantifiability, what I heard of, you said it deals with numbers, but I don't really get it. So if you could
Okay.
explain better for me.
So what I was saying is that when it comes to quantifiability, in any scientific realms, yes, quantifiability is really what imperative. So, but one might ask, why do we normally say psychology is a science if we are saying every scientific realms, um, there should be that sort of quantifiability? Then I indicated that even with psychological constructs like depression, anxiety, aggression, we have been able to find ways and means to quantify them. So that's why I use the Beck depression inventory, walking you through how clinicians normally quantify people's depression and say, oh, you have this number of depression. So hence you have mild depression, extreme depression, or severe depression. So that's what quantifiability is all about. It's about um, putting the various contrasts or behaviors we are studying in a number form. All right. So the last person is Bridget. Bridget. Bridget, kindly unmute your mic.
Sir, please.
Okay.
Yes, I've done that. And please, with the Beck's depression inventory, with the empirical evidence, you use this as an example of assessing someone clinically. And then again, we used it under the quantifiability character. So it can be used under the two.
Bridget, I'm really confused when it comes to your question.
I am saying that when you were giving examples under the empirical evidence, you stated the Beck's depression inventory as one means of observing someone clinically so that you can draw your conclusions or make the person go for lab investigations or whatever in terms like in relating the case to depression. But when we came to the third quantifier, the third characteristic, that's the quantifiability, you use the Beck's depression as means of quantifying how serious a person's depression is or whatever. Sorry for my words. So I want to know if the Beck's can be used under any of the characters of science, or is just the two, empirical evidence and quantifiability.
Let me clarify this. The empirical evidence, I was trying to let you understand the various methods we can use to gather evidence. And in scientific realms, especially in our clinical setting, mental health, it is much more expectant that you shouldn't only use one of the methods to come to conclusion. Ideally, you're supposed to use all the three methods before making a diagnosis. When I say coming to conclusion, making a diagnosis. So that's why I said you're supposed to observe, do the interview, then run tests. But in our department, we run tests using psychological tests. And one example of the psychological test I just use is Beck depression. We can have several types. Even with depression, we have several psychological tests under depression. But I just use BDI as an example. Then with the quantifiability, I was trying to put across that within scientific realms, we are saying that always you are supposed to quantify the behavior of interest. So in psychology too, the same thing, all the behaviors of interest. And psychology, what behaviors are we studying? Psychological constructs like depression, anxiety, aggression, and what have you. So when we are quantifying these things, we also use psychological tests. So I mentioned Beck depression inventory again as an example, just to help you appreciate that since we want to quantify our construct, we use an example, Beck depression inventory, and I walk you through how even Beck depression inventory is normally used, whereby you're supposed to, after you've administered onto your patients, you're supposed to score and interpret. So the scoring gives you a number, telling us that, confirming that, okay, we've been able to quantify a psychological construct like depression. That is the impression at hand. Okay. I think I'll give the last two questions and that opportunity to ask their question, and also then I'll go ahead, or else we wouldn't close today. So, oh, sorry. The person, I just lowered your hand, so please, you can raise up your hand again. Sorry about that. I just lowered your hand. Sorry about that. So, Habibatu, please go ahead. I'll give the first two. That's Habibatu and Aziz,
Yes,
and that'll be all.
Yes.
All right.
Sir, my question is, you first gave a scenario about a guy, a house boy and a madam. So please, can you use the house boy and the madam as the four characteristics you gave? Now, can you still use the four characteristics to compare the guy and the madam statements?
I am lost, Habiba. If I get
My
you well,
issue,
the boy and the madam scenario that I gave was tied towards the empirical
accept.
evidence. I was trying to explaining the empirical evidence, how you can gather information using, yes, how you can gather information. So I use
But
the boy
you
and the
can
madam
use,
scenario.
okay, but you can use it under the quantifiability and the generalizability and the rest. You can use it under that place.
You can use it
Hello.
as in the example it was an example that I was given to explain
Okay.
empirical evidence, whereby I said with empirical evidence, three methods are used. You observe, you do what you interview, and you are supposed to run tests. So I use the boy and the madam situation to let you understand how information is gathered. But if you want us to
Okay.
use the same scenario to explain the other three, it can be done.
Okay. Okay.
But the
Okay.
scenarios given to explain will be different.
Okay. Okay.
All right.
Thank you, sir. I've understood.
All right. Then the last person, and that'll be all. So please, Aziz, please go ahead.
Um, Sir, please, with regard to the quantifiability, I want to
Okay.
ask that if a patient comes to the hospital and patient is in severe pain and the doctor asks him that according to the pain management skill that he should rate the quantity or the number of pain that he or she is feeling. Can that one be classified under the
You should rate
quantifiability?
the number of what?
Maybe the number of pain, like maybe from 0 to 10.
And the pain, her pain.
Yes. So you
The
are
doctor
being
was
asked.
sorry, the doctor was saying that you should rate the number of pain the person is
The doctor,
experiencing.
the doctor is using the pain management skill to
Okay.
rate the patient, like the severity of the pain that the patient
Yeah,
is going
yeah,
through.
yeah.
The
It's
patient will
typical.
be
Sorry to cut you. Yes, it's typical of quantifiability.
okay. Okay.
because
Thanks.
because one thing about pain is that um the patient, that's one of the key things we normally do in our setting. The patient is the one supposed to rate for us to know the severity of, for instance, the pain in that regard. So sometimes either a small sheet to be given to her to fill, or you can just profess it and let the person spew it out. So that's typical of quantifiability.
Okay. Thanks a lot.
All right. Okay. So yeah, so we are also discussing behavior. which is the second part of what of the definition within psychology. So usually I don't stick too much with regards to the definition of behavior. My main concern will be on the various types. The various types. That will be where my focus or concentration will be on. So the types of what of behaviors. So holistically, we can divide behaviors into two main types. Two main types. We have overt, the one without C, overt behavior, and covert. So overt behavior and covert, covert behavior. So overt behavior, that's the one without C, overt behavior. They are behaviors that we can't really what observe using any of our sense organs. Oh, sorry, they are behaviors we can observe using our sense organs. That's overt. So you know of the five sense organs I'm referring to: your eyes, ears, nose, skin, tongue. So any behavior that you could easily what use these sense organs to what to um sense them and process it. It means that that sort of what behavior you experience is what is an overt behavior. So, for instance, you seeing someone dancing, it's an overt behavior because you use your eyes to what to see the person doing the act, seeing someone walking. So all the things or hearing someone. So at the moment you could hear me what talking, which is typical of what of an overt behavior. But with covert, there are the various forms of behaviors that you can't really observe with your five sense organs. You can't use the five sense organs to what to observe such things happening. So especially people's what thought process. There's no way you can know what the person is thinking about, but the person is what is really um behaving in that manner by thinking. So thinking is a form of behavior, but a third party can't really um observe that you are doing it. So that is an ov is a form of covert behavior. Is a form of covert behavior. All right. Then these two main types can further be divided into four categories. These two main types, that's overt and covert, they can further be divided into two main broad types, which are so the first one that we'll be tackling is reflex behavior. And I think reflex behavior is something that you have come across it. I think back in our days whereby we were in SHS and JHS, whereby we were were exposed to integrated science. We used to have something known as reflex action or reflex act, which is a form of reflex behavior we are referring to. So it means generally reflex behavior, they are behaviors that we don't have control over. It happens to us involuntarily. So it is an automatic what response that we do. So a typical reflex action or behavior that we do is you hiccuping. You don't have control over hiccups. It just happens to you. You sneezing, that's also another reflex what behavior. Or sometimes when a pin what pricks you, what do you do? Yes, you sometimes jump from the pin. especially when it pricks your foot or something, or you step on it, just what you just withdraw your hand. Or ladies, whenever you are cooking, then all of a sudden you forgot to use the um the napkin. Then unfortunately, you use your bare hands to touch the hot saucepan. It is a reflex behavior. You automatically what? Withdraw your hand. That's how reflex behavior happens. You don't have control over it. Then the next one is goal-directed behavior. Goal-directed behavior. With goal-directed behavior, they are more or less like behaviors people exhibit based on certain objectives that they have, based on certain goals that they've set up for. So it is the goal is the one which is really what fueling them to commit an act. When I say commit an act, it is the goal that is causing them to behave in a particular manner because they have a goal in mind that they want to achieve. So, for instance, currently you attending a lecture, you have a goal at hand that you want to achieve. That is why you've attended lectures, or you will be you sit for an exams. It's because of the fact that you have a goal at hand. So it is the goal that is really what pushing you to exhibit certain behaviors. Coming back to school just to learn certain concepts. It's because of a goal at hand that you intend to achieve. So that sort of behavior you are currently exhibiting because of that goal is like you attending a lecture or you sitting for an exams. That goal, that behavior is usually referred to as a goal-directed behavior because you have a goal at hand that you want to achieve. So hence, it is pushing you hard towards to behave in a certain manner. All right. So I think the example that I used was a child who has a goal of me sating my hunger. So what would the child do? Will do everything, will exhibit certain behaviors so that his or her goal will be what to be achieved by crying profusely just to get the attention of the caregiver or the mother to be fed. All right. Then the next type of behavior is referred to as frustration behavior. Frustration behavior. With respect to frustration behavior, they are more or less like initially it starts like a goal. The person has a goal at hand that he or she wants to achieve. But halfway of the person trying to achieve his or her goals, the person goes through series of turmoils or frustrations. So it means that the person is not able to achieve that goal severally. And when later that goal is met, you can see that the person does not really appreciate him or her achieving that goal. The person is not all that happy in because of him achieving that goal because the person felt I went through a lot of frustration to achieve that kind of goal that I really wanted to achieve. So we call that sort of behavior frustration behavior. A typical example is a student who, right from level 100, um, came with the intention that um, I really want to be, say, maybe a valedictorian. When I say valedictorian, that's overall best or what have you. that's the goal at hand. Then, in the course of him or her achieving such goals, person went through a whole lot of frustration. Like, okay, certain one course that she wrote in level 100, she got an F. Level 100, level 200, an F, 300, an F, then 400 is able to achieve that goal, get an A. When the person throw his or her mind back just to reflect on how she went through several frustrations to achieve that A, the person feels Charlie Mabredo. And you could see even getting that level 1, getting an A within that course, the person's satisfaction is quite really what low, because he or she really suffered too much to get that kind of A that she really wanted in that manner. So when it happens like that, we call that sort of behavior frustration behavior. All right. Then the last goal is something known as conditioned behavior. So conditioned behavior is more or less like certain habitual practices people do for a while, which become part and parcel of them. Such certain habitual acts people do for a while that become part and parcel of them. We call such behaviors what? Conditioned behaviors. So a typical conditioned behavior is some people are conditioned, for instance, to experience some phobias. Phobia is a form of anxiety. So some people they have phobia for spiders, phobia for snakes, and what have you. So let me use this scenario. I had this female friend who happened to have serious phobia for snakes, to the point that when you are walking with her along a lawns like green grass and what have you, and you tell her to um, be the one to be closer to the lawn, she will tell you, nope, can you be within that side and I'll be at the other side. The person doesn't want to get close to the lawn in that, and let alone walk within the lawn. Why? Because she feels even her walking along on the lawn at the edge, whereby they've carved a path. The person thinks, okay, I might be bitten by a snake. And she had this prolonged phobia because of back in SHS, something happened. She was in SHS in a boarding house, and a close friend of hers, she saw her being bitten by a snake within a green grass. So out of this, she has had this long-standing act of having serious aversion towards snakes, let alone green grass. It's a no-no. So that's typical of how conditioned behavior springs up. All right. So that'll be all. That'll be all for today. So there's a time I'll give opportunity for you to ask all the questions that you really want to ask concerning what we've discussed today. So I think the first person whose hand is up is Yaya. So please, Yaya Amata, I have unmuted your mic. Please go
Hello.
ahead. Hello, dear.
Good evening, sir.
Good evening.
Hello. Good evening, sir.
Good evening.
Please, sir, with the explanation, sorry to send you back.
Okay.
My network wasn't good. It wasn't stable. with the
Oh,
characteristic of scientific study, when you go to the explanation of quantifiability and then generalizability, I didn't get the explanation. My network was very bad.
oh, so sorry about that. The fortunate thing is, the host, who is the IT personnel, is also what is also recording, and I
Okay, okay,
believe,
okay.
yeah, you can have access to the recordings and everything. But
All right.
what I was saying about generalizability and quantifiability was that with quantifiability, I indicated that we are normally we put most of our construct, like psychological construct, in numbers, in a number form. So I was using Becky depression inventory to walk you through how quantifiability could be done. So usually depression, for instance, we use some of these psychological tests like Becky depression inventory to find a score for our patient so that we can say, oh, this patient has depression, like his number of depression in him or her is maybe 15, based on the Beck depression inventory to give us a number when we calculate. Then we can then use that number to come to conclusion and say, oh, this patient has severe levels of what of depression and what have you. So it means we've been able to quantify all the psychological construct like any other construct, like weight, height, temperature. We've been able to quantify it in that manner. Then with generalizability, I was saying that in most situations, the ultimate goal of every findings that we've gotten is to generalize the findings to wider group of individuals. So I use the COVID-19 as an example. That you could see that COVID-19, when it was prevalent, these scientists never came to you to do any test before saying that, oh, the symptoms of COVID-19 are A, B, C, and D. They never came to you to do any testing. But what did they do? They just did experiments and studies on what? On few samples or few individuals. Then after they studied how the virus works within such individuals, they just came to conclusions and say, oh, human race, this is how the virus works when you contract it. So when you contract it, you would also experience these symptoms. So be alert. So they doing that, it means that whatever experiment that they did and whatever findings that they came out with, they have generalized the entire findings on what? On the entire human race. That's how generalizability is. They've generalized the entire thing that, okay, if you also contract it, this is how you would experience it. Though they never came to you to do anything. Yeah. So I hope this to some extent explains. All right. So I think let me move on to the next person, which is Elizabeth. Elizabeth Sapon. Please go ahead.
Okay, so hello, sir.
Please go ahead, Elizabeth.
Please, when we were talking about the behaviors,
Okay.
if I heard you right, you said we have the overt and the covert, and under that we have two main types. That is the reflex and the goal-directed behaviors. So, sir, please, where will the frustration and the conditioned behaviors fall under?
Elizabeth, sorry about that. I never said we have two main types under overt and covert. I said when it comes to behaviors, we have two main types, which is overt and covert. Then these types can further be categorized into four main types. That was what I indicated. They can be these two main behaviors can be categorized into, then we move on. So I said they can be categorized into four main. So the four main types is what we discuss.
Okay, thank you, sir. And sir, please, my last question. With the conditioned behaviors, Please, can we link it to post-traumatic stress disorders?
Not necessarily. Why? Because what we are trying to say is that when it comes to these behaviors, they are more or less like some people learn some of these behaviors from certain issues that has happened. So
Okay.
the reason that's what I'm saying, it's not necessarily always tied towards post-traumatic stress disorder, is that with PTSD we have other explanations as to why it really sprung up in that
Okay.
regard.
Okay.
All right.
Thank you, sir.
You're welcome. So I think the next person is Aziz. Please go ahead. Madam Aziz, please amplify your voice. We could barely hear you. I could see that you unmuted your mic, but we could hardly hear you. Hello. All right. So, Bridget, please go ahead.
Sir, please, my
Yes,
question
yeah.
is on the conditioned behavior. Can
Okay.
we say those who bite their fingers, like the beyond session, can we say those people are exhibiting conditioned
Yes,
behaviors and also
yes.
alcoholics?
Why? Because it's a habitual practice that they've done. So yeah, you can put it in that
Please, I didn't hear you.
I said, yeah, you can put it in that perspective, especially those who bite their fingers, because it is a habitual, long-standing habitual practice that they've been doing. So yes, you can
Okay.
put it in that perspective.
And what of alcoholics?
Alcoholics, yeah, to some extent. Yeah. So
Okay.
as I said, conditioned
My
behavior,
next
if it is a
question is
long
on.
stand, okay. Please go ahead.
Okay. My next question is on the frustration behavior. You said it
Okay.
starts with a goal. So do they get frustrated because they had a limited time in achieving the goal? Or must anyone who started maybe a pattern or in achieving something with a goal no, demonstrate frustration behavior? For instance, let's say someone tried IVF for countless years. At the end of the day, even if it takes them like 6 years before they could have a child, they are happy with the results that they get. So I wanted to know if it happens with only those who had a limited time to the goal now setting. Thank you.
Yeah, I think to some extent what you're saying makes sense in that regard. One thing about some of these concepts are that it has also its limitation. It's not every person that go through such phases in that manner. So you're perfectly right. But so I believe
Okay.
the
Thank
goal
you.
in itself, when the person set a goal, I think time factor also plays a role, as you rightly said. If the person feels okay, I have set up a goal whereby I feel okay within the 4 years I'm supposed to graduate, and certain things doesn't really go like the way he or she expects, becomes a problem. The same thing applies to the female thing that you are saying. From that perspective,
Okay.
although they have a goal that okay, I want to give birth, but to them they don't matter. They don't care about the number of years it would take.
Okay.
So hence that their goal is quite different. They don't have a time bound. So hence it wouldn't bring up any frustration even when they go through some setbacks.
Okay.
Yeah.
Thank you.
So that wouldn't be a form of frustration behavior. All right. Okay, so I think the next person is Selena. So please, sorry, Selena, please go ahead.
Sir, please. My question is related to the goal-directed behavior. Can you say
Okay.
the can you say the is the ability of attaining um a successful results regarding to your aim, or if possible, you can help me with the explanation very well because I didn't get that one very well.
Yeah, so goal directed simply means right from the word go, you have an objective at hand.
Okay.
So um you are what you are the objective is the one really what really causing certain act in you to us so to successfully what achieve such objective. So that's why I use even you attending a lecture as an example. Even
Mm.
students, let me use undergraduate students as an example. We can all attend lectures, but each person has a different objective as to why they came to school. Some people, for instance, were more or less like forced to come to school. They feel okay, my mom or my dad is the one that forced me to be in school. I used to have a client like that I was treating. She had she has this personality disorder known as borderline personality disorder, and she yeah her parents are serious are coming from serious religious background. That's Jehovah's Witness, which they don't entertain secular music. And here comes the case. This lady is also seriously into music, and she normally moves with Yao Tog and those other Kumasi artists and everything. So she feels okay. I have this platform and I have to utilize it. And her father is saying, no, no, I want you to what to be in school, do engineering. So you could see that okay, her goal is not in line with what her father wants her to do. She went to the uni and you realize that since her goal is different, she was having serious sharp decline in her academic performance. So that's how goal directed is. If um, your goal is different from certain things you are pushed to, that means there'll be inconsistencies. So always goal directed, if you have a goal that at hand, certain behaviors would exhibit. So in this girl situation, since her main goal is to what is to do music, her academics were declining because she was putting too much time in what in that other activities. That is music.
Okay.
And that's how goal directed is. Certain behaviors align with what with your goal. So when it happens like that, then we call it goal directed behavior. All right. So I hope I've
Okay.
answered you. So the last person
Thank
is
you.
you're welcome. The last person is Vivian. Vivian. So please go
Okay,
ahead.
sir, thank you.
You're welcome.
Please, with the conditioned behavior, you
Mm-hmm.
said it is a habitual lifestyle. And I wanted to
Yeah.
find out if the lifestyle, the conditioned behavior can be changed in respect to psychology. And then right now you're explaining with the what Selena just asked with the goal-directed behavior. Is it that you have to have a purpose for your goal to be achieved in concern with the conditioned behavior?
I want to get this. Vivian, you said, is it that you have to have what?
So my question is,
Mm-hmm.
can conditioned behaviors be changed in respect to psychology? Can it be changed?
Oh yeah, with that I got your
And I
question.
wanted
I want the second part. Mm-hmm.
So I wanted to relate it to the goal-directed behavior. Is it that you have to
Okay.
have a purpose for it to be
Okay.
achieved?
That's
Thank
the
you.
condition behavior.
Yes, please.
All right. All right. So one thing is really important. Condition behavior is something that can be what changed since it is
Okay.
a long-standing habitual what practices. And usually it takes some time before it could be what we could change. The phobia that I was referring to, yes, we have psychological interventions we normally use to do that. And also the person biting his or her fingers, yes, we have interventions in that regard. Alcoholism, the same thing. So most of these long-standing habitual behaviors, we have techniques that can be used to help the person or change his or her behaviors. But the key thing is, as you said, the person should have a purpose. For us to say the person has a purpose, the person, we normally, especially with addiction, which is alcoholism, I normally tell my clients, or even some doctors who normally refer, psychiatrists who normally refer certain cases, I normally say that with addiction, if the patient, him or herself, hasn't come to the self-realization that what alcoholism or the addiction has seriously caused certain what negative repercussions in my life and something needs to be done. Irrespective of whatever thing you do, you can take the person to rehab, do everything that you want to do. The person will want to go back to it. So it means that the person should have a purpose and aim that, hey, um, right now I've come to a standstill. I know that this thing is really what's causing or has caused a lot of a lot of damage in my life. So I need to what I need to change it, which is really important. So yes, there are certain interventions, but the person should have that sort of realization. We call it the person should be in the contemplative stage before we can execute certain things. All right.
Thank you.
Okay, you're welcome. So I believe I've answered you guys. So if there are no questions and clarifications, then I think we would end here. That'll be the end of today's meeting. So see you, God willing, next weekend, and have a wonderful evening. Bye. Okay. Jemima, please go ahead. Please be snappy. Madam Jemima.
Can you please hear me?
Yes, I can hear you now.
Hello, sir. Okay. Please, I have a network problem. It was on and off just like that. So can you please give a recap or just a summary?
Oh, Jemima, that will be a lot on my part to do a recap on what we've done today. That'll be a lot. But the fortunate thing is that, as I earlier said, the IT personnel is what they are recording, so you can get in touch with them to get the recordings of today's lecture, so that you can have a gist of everything in that manner. So sorry about that. All right, then bye.